You guys remember when I presented this picture of my brain? This is the photographer.
Oh, all right.
Give you Dr. Clint.
Thank you. All right, so good evening. Thank you for having me here. Can everybody hear me okay?
Yes.
All right. Well, all those things that were mentioned in my training happened a long time ago. And what I wanted to do tonight is just give you, well, actually several kind of presentations on the usefulness of brain SPECT imaging. Actually, yeah, if you could turn the lights down a little bit, that would be great, because the images really kind of speak for themselves. And I got interested in brain SPECT imaging years ago when I first started practicing. I had finished up my training at UCSF and then a fellowship in child psychiatry at Stanford. And when I was with Kaiser for several years, and then went out into private practice. And in so doing, initially had an office presence over in Aptos and met a therapist there who had her son with a very difficult case of attention deficit disorder, some other mood kind of issues that just wasn't responding well to the treatments that they were rendering. And so she had him go up to Dr. Amen's clinic and have a brain SPECT done, and just apparently had wonderful results. Sort of pinpointed the areas that were problematic in the brain function, and then medications were targeted to those areas and had an excellent response. So she set up a field trip for myself and as well as the other clinicians there. And I went up to Dr. Amen's clinic in Fairfield and met with him, and he just sort of showed us through what he's doing. And at that time I was, you know, as most, well, maybe I shouldn't generalize, but I was fairly skeptical about brain SPECT, and because I didn't know that much about it. And you know, medical practitioners are generally skeptical about things that you know, are new or innovative or we don't understand. So I just got more information on it, and everything he was presenting and talking about was a very mainstream, solid psychiatry, just what I had learned in my residency and fellowship. And so then he started showing us some images, and it just made a lot of sense. What I thought was potentially promising about brain SPECT was that it gave us a physiological picture of what is happening inside the brain, that along with the clinical information that, of course, you know, you do along with the brain SPECT, could give us some new insight into what exactly is happening inside the brain that might explain symptoms that patients are experiencing and presenting with clinically. So I sent a few patients his way, had them get the brain scan done, and got the results back, went over the cases with Dr. Amen, and I as well got very good results. It really helped me figure out difficult diagnostic cases or patients I was treating that weren't responding well to medications that they should have been responding well to. And so it helped guide and direct, you know, what I did. So I in fact got so fascinated and interested that I just went ahead and got my training in doing brain SPECT imaging, which is a pretty rigorous, labor-intensive training process that you have to go through. So it took about, you know, 4 years or so of going up there, reading scans, interpreting results, rendering treatments based on the results of the scan. And again, I was getting really excellent results. Primarily using brain SPECT imaging for the more difficult cases that, again, were either diagnostically confusing or weren't responding well to medications or other natural holistic treatments that I was prescribing. And So went through the whole licensing process and then got my own machine. So this is a picture actually of the machine that I use. And let's see, I'm not sure where that laser pointer is, but anyway, this is over on the upper left is what the machine looks like. This is a quadruple headed camera. It's one of the only, I think one of two, or maybe three now in the United States. My machine was actually the prototype, and you know, where we got FDA approval for the use of this machine with BrainSpect imaging. Up to this point, you know, they have single-headed cameras and dual-headed cameras and then triple-headed cameras, which are actually very good. And that's what Dr. Amen uses primarily. Thank you very much. And so let's see if this works here. Yeah, there we go. So this is sort of the latest technological advancement in this field. There are four heads of the camera that are located in these positions here. And basically what you do is you inject the patient with a radioisotope, which is in the process of giving off gamma photons at a very specific energy. And that's linked to a molecule that binds specifically with the cells of the brain, the neurons. And the areas of the brain that are the most active get the highest concentration of these isotope-tagged molecules binding into that area and then giving off these gamma photons, or like beacons of light. And likewise, the areas of the brain that are the least active get the lowest blood flow and less concentration. And so what happens is the camera head just rotates around. The patient's head goes here, they lie here, and the head goes here. And it rotates around. And one of the advantages of the quadruple-headed camera is that it takes less time to do an acquisition. So it takes, you know, you can do one in about 12 minutes. And in nuclear medicine and imaging technologies, the faster you can do something, usually the clearer the image and the better the acuity is. So it's improved the, you know, the image quality, and it's been an outstanding machine. Okay, so what I wanted to do first was just give you the presentation that I give to junior high students and high school students on the effects of alcohol and drugs on the brain. It's a good overview of BrainSpect. It'll show you what a normal brain blood perfusion pattern looks like, and then how drugs and alcohol affect the different areas of the brain. And then, depending on the time and interest, I thought I'd show you some trauma cases, and then a totally serendipitous case that I got of a kid who did some ecstasy and the effects of ecstasy on the brain, which is pretty devastating. And then finish up with how we're using BrainSpect in conjunction with the clinical psychiatric history of the patient to help, not with diagnosis, but just in assessing the patient and seeing what areas of the brain are overactive or underactive, and how that equates with anxiety disorders or Asperger's disorder, attention deficit disorder, and then some of the effects of medications on the brain, and how some of these medications that we're using to treat these conditions are working. Okay, so here's our lecturer on brains, talking about the field of brains. Gary Larson is one of my favorite cartoonists. So, and again, this is just another view of the camera. And so again, as I was mentioning, patient lays here. They have to stay pretty still. Takes about 12 to 15 minutes to do the acquisition. It's the way the head goes in, and it's actually open all the way through. I've only had maybe one patient out of hundreds, perhaps, or thousands, that's felt somewhat claustrophobic, but they got through it. So the nice thing about this, it's not like an MRI where you're just, you know, in this coffin-like structure, so it's very open. So I don't usually get patients complaining of that. Now, this is an image of, and these next several images are courtesy of Dr. Daniel Amen, who is a pioneer in the brain SPECT imaging technology and its application to psychiatry. Dr. Ismail Mina is probably the, say, if Dr. Amen is sort of the father of brain SPECT imaging and its application to psychiatry, Dr. Ismail Mina is like the grandfather. He's the one who really did all the pioneering work in this. He's a nuclear medicine physician out of Chile who did a lot of his work at UCLA Harbor. And so the normal database and you know, just understanding brain SPECT much better came from his work there. And he continues to do outstanding work. And the United States is a little bit behind in utilizing this technology for brain conditions, neurological conditions and such. It's being used, brain SPECT is being used extensively in South America, in Japan, in Europe, and it's much more readily accepted, although just in the years that I've been doing this now, which is probably 5 or 6, I have found it's much more accepted, much more mainstream. You see brain images in all the latest psychiatric publications, and it's just kind of gratifying to know that it's becoming a much more accepted technology. So this is what your healthy, normal brain would look like. This is what's called the isocontour view. Here's the front of the brain, here's the back, and this just basically shows an even distribution of blood flow across the whole top surface of the brain. And as I'm sure you're well aware, different parts of the brain do different things for you. So in the back are the occipital lobes, which do your visual processing. The parietal lobe area, which is in this region here, helps you interpret sensory data coming in from the environment, sort of puts all that information together. So tactile stimulation, visual, hearing, and sort of sends it up to the frontal lobe to be processed. And it also is helpful in your sense of space, position, you know, where you are, you know, east, west, up, down, that sort of thing. And then, of course, the frontal lobes, the most advanced area of the brain, which is for problem solving, abstract reasoning, long-term memory, motor function, voluntary motor function. And then if we just flip the brain over, now we're looking at the undersurface view. So here's the front, here's the back. Now these particular views, we're looking at the blood flow to the outer surface of the brain. And again, we should see this nice, smooth, even distribution of blood flow and symmetry from one side to the other. And so the prefrontal inferior orbital area is the part of the brain responsible for focus, concentration, organizational skills, planning skills, executive function, sort of thinking things through, impulse control, those sorts of things, modulation of the emotion, very important part of the brain. Then, of course, the temporal lobes are responsible for short-term and immediate memory, language processing, and some mood stability kind of functions, as well as interpretation of music. And then the cerebellum is for balance, coordination, and we're actually finding the cerebellum is a lot more important in you know, higher cortical function and actually planning skills, carrying out a plan, and not only in a motor sort of a way, but also in a thinking and planning, a cognitive sort of a way. So, okay, and then this is just another way of looking at the same information. So these images came from my machine. So same idea, you should see this nice even distribution of blood flow across the whole top surface. And then here's the undersurface view. Here's the front of the brain, temporal lobes, prefrontal area, and the cerebellum. So I want you to try to keep these images in mind as we move ahead and start looking at, you know, the effects of toxins, drugs, alcohol, that sort of thing on the brain, and the difference that you'll see. Now, another useful function of brain SPECT imaging is we can look at the inner structures of the brain as well. So basically, the blood flow to the outer surface and the blood flow to the inner areas of the brain. And the typical brain, in this particular view, there's a lot of activity in the back in the cerebellar area, but usually it's very calm and quiet, and that's shown by this blue color. And I don't know if we could dim the lights even more or people fall asleep. I don't want you to go asleep, but you could probably...
I don't know where that light is. Is it
Okay, but can you see this okay, I mean, for the most part? Okay. All right.
I'd like it much dimmer.
Okay. All right, there you go. Yeah, because actually the images, so hopefully, if you do nod off and fall asleep, I'm not going to notice. So go ahead and take cat naps if you want. So here's the front of the brain, back, cerebellum, usually the most active. Now this particular view shows the most active 15% of the brain, which is shown by this red color. And typically from here forward, it's, you don't see a lot of activity internally. So that's what the arrows are pointing out there. And then if we just flip the brain over now, undersurface view, here's the front, here's the back. And as I'm explaining this to the high school kids and such, I say this is sort of the evil snowman appearance where you see these two little dots here and this face kind of appearance, a little sinister looking. But the idea is that from this point forward, the inside structures of the brain and functional systems, I should say, are usually very calm and quiet. And then this is from my machine, so same idea. Here, back of the brain, the cerebellar area, and then it's very, you don't see a lot of activity going on internally at the normal, healthy functioning brain. Now, another way of rendering the information is through this Talairac view, which in this particular view, red is good. The more red you see, the better. And that just, this is again showing the blood flow to the outer surface of the brain. And so it's the right side, the left side. This is looking at the front of the brain, the anterior view, posterior is the back. Here's the cerebellum. The superior view is just, here's the front, here's the back. And so we just, the red just shows even distribution of blood flow across the whole top surface, and then the undersurface view should look like this. And the color scale we use is over here to the left of the screen. So in this particular view, red is normal and healthy. So this is just an enlargement of that. Okay, just add a little humor, never one to follow the crowd. Bob has his brain pierced. And I'm not sure who the cartoonist was here, but I guess, what does that say, Boyd? Anyway, people pierce their brains in a lot of different ways, and one way is through drugs, alcohol, that sort of thing. So now we'll start looking at what those do to the brain. So here's a 37-year-old male who had been drinking for about 17 years. And here's the front of the brain, here's the back, looking at the blood flow to the outer surface. And what I usually ask, you know, the teens and all be asked, do you see a difference between this brain and the normal healthy brain? And what do you see? What's different about this? Holes, yeah, that's what holes in the brain. So now remember, this is a functional brain imaging study, so it's looking at how the brain is functioning. A CAT scan or an MRI, a regular MRI, will look at the anatomy and the structure of the brain. This is looking at how that structure is actually in the anatomy is functioning. So if you were to do an MRI or a CAT scan on this particular individual, it would probably look relatively normal because all the brain tissue is there, it's just not functioning properly. So here we have just a marked decrease in the blood flow to the whole top surface, and then here in the undersurface view, remember now the prefrontal area, this is the same individual. He's been drinking on the weekends, not every day. Here's the prefrontal area, and remember, we're supposed to see a nice even distribution of blood flow across the whole prefrontal surface. That's the part of the brain that's responsible for focus, concentration, executive control, impulse control. So usually I put out the question at this point, how would you like to be driving with this person who really doesn't have very good impulse control, executive control, planning skills? His attention is going to be shot. Temporal lobes also get affected by alcohol, and then also the cerebellum, which is for balance, coordination, judging, distance, space, that sort of thing. And so the main point of why I give this presentation in schools is just to, enlighten kids as to what they're doing to their brains when they're drinking, and how dangerous it could be to be driving either intoxicated or with someone who is intoxicated under the influence. Here's a 44-year-old male with 18 years of daily alcohol use, so you see the same effects. The prefrontal area gets hit really hard, the temporal lobe region, and then the cerebellum. Here's a female who's been using for 22 years. So there doesn't seem to be any differential between the effects of these toxic substances on male or female brains. There's same effects: decrease in the prefrontal area, temporal lobe region, and the cerebellum. So the length of use, just will basically cause more and more damage as time goes on. Now, here was a 54-year-old gentleman who was sort of a functioning alcoholic. He had been working, for many years. He was a heavy drinker. He drank pretty much every night, probably about anywhere from a half of a fifth to a fifth of vodka in one form or another. And he was not doing well at work. He was not doing well in his family. He didn't realize or think that there was any problems, but his family obviously were seeing a lot of problems going on in his behavior, his memory, and functioning. And so they talked him into coming in and getting a brain scan. So I did the scan. And so you see, again, this just what we call scalloping, which is a decrease in the blood flow across the whole top surface of the brain. So this is abstract reasoning, problem solving, position in space, integration of sensory data, visual processing, and then his prefrontal area also, marked decreased. Temporal lobes are just almost non-functional. And obviously this gentleman was having severe memory problems as well. His cerebellum is markedly underactive, so balance, coordination. In fact, he had the typical, I'll answer your question in just a second, okay? Gait that you see with individuals who have been drinking for years, where they have this sort of wide-based gait, because if they walk, like this, they'll lose their balance because the cerebellum is so badly injured. So, question?
These things get better when they stop drinking? Or is it the
Yeah.
damage, and this is the state of
Okay, yes, excellent question, which is, does the brain function improve or get better when a person stops drinking or stops using the substance? And I actually have I'll show you, a case where we'll see, if it changed or not. Typically, really depending on the substance that one is abusing, the extensiveness of the use, how susceptible a person is, to the damaging effects, those all are factors in this. However, the brain does seem to be pretty resilient. So if a person stops and gets off, whatever drug it is they're using, they usually do regain a lot of function. So there is a healing effect. It can take 6 months to a year. And the really strange thing is that if that person, however, goes back to drinking, after a year of sobriety, and they're doing significantly better, their brain goes right back to the worst state it was in when they were in the midst of the heavy drinking. And we don't know why that happens, but it's almost like it has a memory and it just clicks right back. And then, you know, it just takes one use, and so really falling off the wagon is literally falling off the wagon. And then it'll take another 6 months to a year to, you know, to recover again. So it's, we don't quite understand that, but it's been shown to happen. Now this is the same gentleman, just looking at the Talairac view. So remember, we're supposed to see red. And so first of all, we see, you know, a marked decrease in this top surface. So this is yellow and green, showing, you know, the blood flow is really markedly decreased. Now blood flow follows activity. So the more active your brain is, the more blood flow it draws to it in order to get glucose and oxygen and nutrients to that area. So basically that's just a, you know, side note. So he has marked decreased activity and blood flow in this top surface, in the prefrontal area, which is again focus, concentration, impulse control, temporal lobe region, and in the cerebellum. And it was interesting, when I went over the results with this gentleman, I think it did hit him pretty hard because he got almost lightheaded and faint, almost had a fainting spell, and I think it just sort of shocked him what his brain looked like. And that's one of the most valuable things I found with BrainSpect, especially with the effects of alcohol and drugs on the brain, is it just cuts through that denial. You know, if you have your scan done and you see this, it's pretty sobering. This was an individual who was scanned at Dr. Amon's clinic, who came in complaining of trouble with focus, concentration, and thought he had ADD. And so Dr. Amon did the brain scan, and he saw this. And I remember talking with him about this particular case, and he said he thought maybe there was something wrong with the machine, or it wasn't a good acquisition or something. So he reprocessed it, and indeed, you know, all the numbers were right, and it just, this person's brain was significantly underactive. And so we went back and said, well, is there something you're not telling us, or what's going on? I mean, this is not just ADD. And then he said, oh, sorry, doc, I forgot to tell you I've been using heroin for 10 years, you know. So anyway, when I asked the high school students about this, the term cottage cheese or Swiss cheese usually comes up. But this is, I mean, unbelievable, the devastation going on here. This is the same guy. This is the frontal view. So here's the front of his brain, and here the whole, it's like the whole top part of the most important part of the brain is just not functioning at all. And so this actually was very instrumental in him realizing that he was destroying his brain. And so from what I understand, he got into a treatment program and started working a program. Now, another thing I hear typically from teens, and I don't know how many in this group are healthcare professionals or just work with youth, but this marijuana smoking thing is epidemic. It's really scary to think what our next generation is going to be like, because you know, they're doing studies which are showing that a large percentage of high school kids are smoking marijuana on a regular basis. And of course they'll tell you it's natural, it's just an herb, it doesn't do anything, it's not dangerous. And now this was a 17-year-old kid who started smoking marijuana, just 2 months of use, and he was smoking maybe 2 to 4 times per week, and he was noticing memory problems, concentration, focus problems, and he was, you know, concerned that he talked his parents into bringing him in, and they agreed. So I did his scan, and now in this particular view, it should just be yellow like this all the way across the whole top surface. So we're already seeing changes in the blood flow and the activity, and it's already starting to shut down even after just 2 months of use of marijuana. So, and then this is the same kid, just looking at it from a different view. So here's the prefrontal area, and you can see now in this view, it should just be orange going all the way across. So he's already doing significant damage essentially to the prefrontal part of his brain, which is why he wasn't focusing and concentrating as well. The temporal lobe region, which is the short-term memory. And those seem to be the areas that marijuana hits the hardest. So it's almost like it induces or brings on an attention deficit disorder type syndrome, because attention deficit disorder is just physiologically and genetically the prefrontal area underactive. So marijuana seems to bring on, kind of an attention deficit kind of problem. Now here's a 16-year-old who's been smoking marijuana daily for a couple years. So you can see the damage is even more extensive. So again, when I show these images to kids, at least it makes them think. And but there is this kind of like folklore belief out there that marijuana just doesn't do anything bad to your brain. Now, in certain situations, medical marijuana can be useful for like cancer patients who are getting chemotherapy and they've just totally lost their appetite. It stimulates their appetite. For some pain syndromes, it can be helpful. So in certain very specific situations, when you weigh the risks, the benefits and all, it can be useful, but just to be used recreationally for no medical reason, it doesn't make any sense, at least in my opinion.
Is blood flow, is that what that's showing?
Yes.
So,
Yeah. Yeah, so this is reduced blood flow in the prefrontal part of the brain and the temporal lobe region. So again, if you were to do a CAT scan or an MRI scan of this kid, it would look normal because the brain tissue is all there. It's not causing, cellular death. It's just these areas in comparison to these are significantly less active. So it's like the drug is shutting down that part of the brain.
So is that why it actually helps with the pain, because it shuts down sensory areas in the brain that are registering pain?
Well, yes, in essence, it decreases the activity in the basal ganglia region and the thalamic region, which are sort of like the relay centers for the interpretation of pain centrally. So it does do that. So that's a very good question and point. That's probably why it does help decrease pain in certain situations. Okay, and then here's a 28-year-old who's been using marijuana for 10 years. So again, you see, the damage going on here. 38-year-old, chronic marijuana use. So I do a lot of marijuana slides because, that's the big drug of choice right now amongst high schoolers. Now, this is a very interesting case. This was a 57-year-old gentleman who actually was a physician, surgeon, I believe, and he had been using marijuana, for like 30 years, and he was not functioning well at the, in his practice, and had to basically step back from it because so many bad things were happening, and decided to go into the Dr. Amon's clinic and get his brain scan done because he was also experiencing significant depression, anxiety, a lot of other problems. And so this is his brain off marijuana. And you can see, again, in the prefrontal area, so this is the decision-making, impulse control part of the brain. It's just shut down significantly, and his temporal lobes for memory are also significantly decreased. But the real interesting thing is what was going on inside his brain. So remember, this is the active view of the internal functional systems of the brain. Here's the back of the brain, cerebellum, which is supposed to be red and active like this, but from here forward, remember, it's supposed to be just all blue. So each one of these areas that are overactive has significance. So for example, that region there is the limbic area of the brain, and when that area is overly active, it's been strongly associated with depression symptoms, a lack of motivation. The limbic area is the part of your brain that regulates the sleep-wake cycle, motivation, desire, interest in things, energy level, positive versus negative thinking. And he has significant overactivity in the limbic area, which is causing depression symptoms. And that usually comes from decreased or low serotonin. The other area of his brain that's significantly overly active is the basal ganglia region, which is here. And this is the part of the brain responsible for coordination of fine motor movement, as well as sort of setting the anxiety tone. And the fight, flight, or freeze mechanism of the brain sort of comes through this basal ganglia region, and anxiety symptoms as well. So that's where his anxiety was coming from. And now here is Dr. Amen had him smoke some marijuana and rescanned his brain. And if you notice, there's actually a marked improvement. I mean, this is a much more normal looking inside part of the brain. So the limbic area is significantly improved. Basal ganglia have pretty much gone back to normal. And this guy would describe that, yes, it gave him temporary relief from these symptoms. The problem, though, is that in addition to, sort of self-medicating and helping himself temporarily, it was causing these real problems in the other very important parts of the brain. So, he was self-medicating and treating certain symptoms, but causing a lot of damage in other parts of the brain. So with this information, he was able to get into a treatment program, get off the marijuana, and got treated with a mood stabilizing agent and a serotonin reuptake inhibitor, and improved significantly, and was able to get back to his practice. But it's these sorts of things that, how would you like this person to be doing surgery on you? Or how would you like this person to be flying the jet plane that you're flying in? Or even more perhaps important, what about politicians, who are making decisions for us? So, I sort of facetiously say we should, just do a screening brain scan on anybody running for, public office, just to see what's happening, if they're going to be able to make good decisions or not.
Did you
Was there
do any follow-up scans after you think he was treated with standard antidepressants, showing that there was a difference?
I didn't.
The scan looked the same, and clinically you think he was better.
Dr. Amen did these scans,
Right.
and so I'm not sure if he did a follow-up scan.
Because that would
On-
be the real,
Yes,
that would be the real tale of this whole story here.
right.
If you did the follow-up and it still looked the same, but clinically you think he was better, then the question is, of what value of scans?
Exactly.
Okay.
Yes. So now those types of studies have been done. So, for example, there was an individual with a severe obsessive compulsive disorder, and to the point of being, rageful and acting out in a lot of anger sort of ways, and had significant road rage. And his scan showed overactivity in the cingulate part of the brain, which is the part of your brain that when it's not overly active, it allows you to be flexible, easygoing, cognitively flexible, and transition easily, not get stuck on things, not be obsessive. And he was and he had overactivity in the limbic area as well. This was a few years back. He was treated with clomipramine with a good response, and he was rescanned after several months of treatment, and there is a marked improvement. So, but that's a really good point. I think that would, those are the types of either case reports or studies that we need to do to bring more legitimacy to this, technique. I mean, if we just did a few of those and it was all controlled, and everything was done properly, I think that would really help the medical community to see the value of this. And now we're seeing these things clinically, and I do have a case where I'm going to show you the effects of EMDR on a post-traumatic stress patient. So you kind of see a before and after. There's some other ones that I'm going to show you with attention deficit disorder, and before medication and after medication. So we do have some, at least case reports on that.
So as long as you stay on the drug, in the case of
Clomipramine,
he looked normal. And then in the case of people who had taken heroin or taken marijuana and then took a puff of it, they looked normal. Also true with alcohol, also true with heroin. Would they look normal if they took the drug even though it's causing damage ultimately?
Now I'm not sure the question.
The question is in the case of the surgeon who took
Mhm.
marijuana, his brain looked normal. Would it also be true in the case of any other substance, that their brain, when it was under the influence of the substance, it would look normal?
Oh.
Has that
Right.
been done?
Well, that has been, okay, so the question is, with this particular individual who had significant overactivity in the limbic area, in the basal ganglia region and other parts, and when he smoked marijuana had a calming effect, I want to, reemphasize that in addition to having the improvement in those areas, he was actually causing damage to the other parts. Dr. Amen also did the very interesting, well, it was I think it was another PBS report on the effects of alcohol on the adolescent brain. He was just one of 15-minute section on that, and then they did other sections of the report basically showing the effects on the liver and the heart, and the kids went into the pathology lab and were looking at all the effects of alcohol in the different parts of the body. Well, one of the segments was they had two teenagers, and a sister who was a teenager and the brother who had been drinking heavily for many years, and he had turned 21. And so they did a brain scan on him, and it did show, decrease in the prefrontal area and the temporal lobe region. Then when he actually, under the supervision of a highway patrolman, he drank beer to the legal intoxication limit, and they rescanned his brain, and there was significantly less blood flow in the already underactive prefrontal part of his brain, and the temporal lobe region and the cerebellum. So it looks like the acute effects of at least alcohol makes the situation worse.
How about the 100 million people who chew khat or use cocaine in Peru? Have they been done to prove those are causing brain damage?
Well, let's see. I do have, here's a methamphetamine abuser, which shows, decrease in the top surface. And then here's a 24-year-old using cocaine. So my guess is, if someone down in those regions, is using cocaine, or hundreds or however many millions you said are using cocaine on a regular basis, if we were to scan their brains, my guess is they would probably look similar to this.
You're actually using coca leaves, which is a much lower dose. So it's
Oh.
actually at an herbal dose. Yeah.
Oh, well then it may not be so damaging.
It's more like drinking coffee or something.
Okay.
By the way, how about coffee?
Yeah, actually I don't have an example of this, but there was Dr. Amen, now these are just case reports, so I don't know if this is general, we can generalize from this, but he did scan a woman who was drinking, I think, 4 pots of coffee a day for like 20 years. And it was similar. It showed toxic effects, but that's pretty massive use of caffeine. And So, whether, having a latte every day, is going to do the same thing. No, probably not.
What about all the Prozacs? Are they affecting the brain in the same manner?
Prozacs?
Mm-hmm.
Yeah, the SSRIs. Well, the case reports that have been done, people who are depressed, and then they're treated with SSRIs, and they have an improvement in their symptoms, and then they're re-scanned, there's actually an improvement. So it doesn't, the prescription medications, if taken as prescribed, don't cause damage or toxic effects in the brain. Now, I have seen with some of the antipsychotic, atypical antipsychotic medications that are like Abilify or Risperdal, they're very useful in people who have like bipolar disorder, or even in autistic kids or Asperger kids who have marked overactivity in a lot of regions of their brain because they have a nice calming effect. But at higher dosages, I have seen those sorts of medications can kind of shut down the top surface of the brain. So whether that's a toxic effect or just a subduing effect, or the permanent, problem, those patients will describe that they feel a little duller cognitively and can't think as clearly, and they're kind of fuzzy in their thinking. So those are the only medications actual prescription medications that I've found that can cause some of these decreases in the blood flow in the top surface. So you always have to weigh out the advantages and the disadvantages, the risks, the benefits. I mean, if it's helping a kid not throw chairs through the windows and attack people and, just cause physical damage to himself or others, and it's maybe making him a little less cognitively sharp, then you have to kind of weigh that out.
Do the toxins in the mercury, formaldehyde, and other toxins in vaccines show up in the brain?
That's a great question, and I don't know. Yeah, there's some indication that certain kids, this isn't really answering this question, but the vaccinations that contain mercury, that some parents I know who've been in my practice have said, my child was completely normal until they started getting the vaccinations, and then they changed and got more autistic and Asperger-like. And they used to have mercury, as a preservative in those vaccines. And so there may be something to that. It's on the biochemical level. Glutathione is a agent and a sort of a neurotransmitter slash toxic removing substance in the brain that some kids who genetically are sort of predisposed to having glutathione problems, who get those vaccinations, it wasn't able to remove the mercury like it ordinarily would. So there may actually be some toxic effects that they're more susceptible to that caused some autistic kind of symptoms. So that's sort of under investigation.
5 and 9 shots at one time, these vaccines, and they have 8 to 10 toxins in them, so it's just too much for the small child's brain.
Yeah,
to handle. That's what I've been reading.
I think that's probably true. I mean, it's definitely true.
Does that also apply for someone who's on a cocktail of prescription drugs, 6 and 8 prescription drugs at one time?
So if the question is someone were on a cocktail of 6 or 8 prescription drugs at a time, so if we're talking pain medications, antipsychotics, mood stabilizers, maybe some anti-anxiety agents, muscle relaxers, those can start adding up and causing toxic effects. So that's again why And you know, that happens maybe more than we think, because you'll have a patient who gets their pain medications from this doctor and their psychiatric ones from this doctor and their you know, other medications from this doctor. And so if everybody isn't on the same page, then you can really end up with some problems. Okay. All right. Oh, so here's an individual who had been abusing alcohol, amphetamines, cocaine for many years, and you can see the toxic effects basically, and then the undersurface view, pretty devastated, prefrontal lobe, temporal lobe region. Again, this individual came in, saw his brain scan, was shocked. He got into a treatment program. Came back after a year of abstinence and was rescanned, and so here is his brain after a year of no use. So that's a significant improvement. So he was kind of lucky. You know, other people may be more susceptible to the toxic effects, but you were asking, you know, can there be healing? And yes, there can. So this represents, and I mean, this is a real case where this guy, you know, brain function significantly improved. Now, he still had some decrease in the prefrontal area, temporal lobe region, but that's a lot better than that. So what I tell kids basically is, you know, if you haven't started using drugs, don't. If you are using them, then stop and don't, you know, use them again. Because a lot of times when I show these slides, you know, the adolescent mentality is, oh, well, you know, I can just party for 20, 30 years, and when I'm an old person, then I can just stop using and my brain will be perfectly fine. So I try to counteract that with that statement. Okay, so that's that.
What's the one which brain do you want?
Oh, yeah, so this is Dr. Amon's made a poster of the different brains, which has actually been, again, for educational purposes, images can, you know, tell, what, 1,000-word story. So here's the normal drug-free brain, and then here's the person using marijuana for a couple years. Here's smoking just regular tobacco, teenager. Here's inhalants. Now, inhalants cause permanent brain damage, so that person may not ever recover. That would be like paint. Paint sniffers, you know, gasoline sniffers, but mostly paint. When I was doing my residency at, you know, UC San Francisco, they have a clinical branch out in Fresno, and we had a lady who was just a chronic paint sniffer, and she preferred gold paint. And so literally you'd go in and get this, Krylon, you know, gold paint, and just, you know, inhale it up your nose. Well, she'd come in just totally psychotic and out of it with gold paint all over her face. And it was really pretty sad. But yeah, I mean, they literally take the paint and just shoot it up their nose. Here's cocaine use, and then here's crank, which is speed, and alcohol. So I've you know, provided these and given these, and I know teachers, you know, have these in their health room, and you know, if nothing else, or even parents have gotten these and put them in their pool houses, and because all the kids come over, and you know, at least when you show them this kind of stuff, they have to think, they're going to think, you know, before they're using again. Okay, so that's the first part. A few medications, things weren't working that well, so we decided to get the brain scan. Now we do 2 scans. You do a resting scan and then a concentration scan, meaning the concentration scan is where they're injected with the pharmaceutical and then immediately do a Conners continuous performance test, and that sort of forces a person to concentrate, and that's sort of our standard protocol. And so we had done the first scan, and at that time we were doing scans on Saturdays. So here's his brain. initially. So remember, red is normal, yellow, green is low blood flow, and blue is severe decreased blood flow. So he does have some decreases on the top surface. There's a lot of red though, and it looks pretty good. The prefrontal area is definitely decreased, which is causing the ADD symptoms, and his temporal lobes are markedly decreased, causing some of the learning disabilities and language processing issues. Now, on a Thursday before us doing the next scan on a Saturday, something happened at school. He got really upset, bought 3 hits of ecstasy, took them. He didn't know anything about drugs. He had never taken drugs before, and got really sick, you know, passed out, almost fell off a balcony, rushed to the emergency room. They stabilized him. We decided, well, let's go ahead and do the scan. So this is 2 days after taking ecstasy. So again, here's him before, and here's after. So it's just unbelievable decrease. So he's gone from red, yellow range down to this green, blue range. And it's sort of like a global shutting down of the brain function. And so here's top surface view before, and here's after. And
Scale?
yeah, same scale, processed exactly the same way. And then here's the undersurface view. So he does have decreased prefrontal and temporal lobe region. And then here's him after. So it's just devastating to the brain. Now, another way of looking at it is like this. And so these are the cross-sectional views, which are actually the views that we look at to do the interpretation of the scan. These are more for show, so to speak, just to look at, you know, the global picture. But we actually, you know, read the scans from these cross-sectional views. And this, I can tell you, does not look like a typical 15-year-old. This looks more like a person with advanced Alzheimer's. So you just, in this particular view, and this color scale, brown beige, it should be nice thick brown beige all the way through the entire brain. And so now, remember, here's the healthy isocontour view, which is the outer surface, the blood flow to the outer surface of the brain. Here's him before, so here's the front of his brain, here's the back, and then here's him after the ecstasy use. So you talk about, you know, Swiss cheese. And again, when I show, you know, when you show people this, teenagers and kids this, you get this, oh, whoa, that's pretty bad. And then here's the undersurface view, prefrontal area before, temporal lobes were decreased, cerebellum, and then here's him after. I mean, it's hardly recognizable even as a brain. And this kid was actually usually very impulsive, lively, kind of big mood swings, but he always came in sort of a goofy kind of kid. And the day that he came in, you know, for the scan, and he was just like a lump on the log. He was just lethargic, and he could hardly talk. So, I mean, there was a big change in his personality. Now, I did have an opportunity to rescan him about maybe 3 or 4 years after this incident, because this taught him, okay, I'm never going to do this again. And so I just didn't have an opportunity to get it, you know, set up in a slide, but his brain did recover, thank goodness. So again, this is just showing the effects of ecstasy on the brain. And then this is my little spiel to the kids. What kind of brain do you want? This healthy, drug-free brain, or ecstasy, one-time use?
Do patients get vasculitis?
It doesn't appear to cause a vasculitis. What happens with ecstasy is it just causes this massive outpouring of serotonin. And so they essentially deplete their brain of serotonin, and for some reason, somehow, that just shuts everything down. But it's not a vasculitis because it is, you know, essentially their brain function will come back. I mean, for most. You know, now I have heard of several cases where you know, the person will be using ecstasy for such and so many times, and it's sort of like that 5th time or 6th time or 10th time or whatever, it just, they don't recover. They burn something out. So maybe in that case there was a vasculitis that actually caused some permanent damage. Okay. This was also an interesting case that I wanted to show you. And this is actually now brain SPECT imaging. The actual, you know, FDA approved indication for brain SPECT imaging is for evaluating brain trauma, and that's any type of brain trauma. So that could be, you know, blunt trauma or gunshot wound to the head, or someone who, you know, fell off their bike and banged their head, or got concussions like football players or you know, hockey players, people like that. And for localizing overactive areas for seizure, you know, intractable seizures where the neurosurgeon is going to go in and actually excise, you know, the locus of the overactivity so it can localize those areas very well. And for evaluation of dementia and Alzheimer's. And so the using it to get information about those particular areas is actually very helpful, and that's the indication. But in addition to that, we get all this other incredibly valuable information about you know, the basal ganglia function and the prefrontal lobe function, the limbic area, and other areas of the brain. So now this was a case of a gal who was a therapist actually working in the clinic where I was at, very sharp, very bright, very high IQ. She had been in marketing before, extremely creative, and then wanted to kind of go into a helping profession. So was getting her training as a therapist and was very gifted at that. Now she was a horseback rider, and she had had several falls, you know, over the years. And with trauma, it seems to be, there is a cumulative effect. So that's why, like when Troy Aikman finally got to his whatever 5th, 6th, or 10th documented concussion, the doctor said, you better quit or you're going to be in serious trouble. Because the more trauma you get, it seems to accumulate over time, and then it's the same kind of thing. You can have this final traumatic injury, and in her case, it was just a whiplash injury. So now prior to all that, she also had some anxiety issues and some possibly ADD issues. So we went ahead and scanned her brain for that reason. And so this was her brain before, you know, seeing a decrease in the prefrontal area and the temporal lobe region. Now, again, totally serendipitously, she was involved in this motor vehicle accident right out, not out here, but at 17 at the junction of 880 and 101. It's just a terrible traffic situation, and the traffic had completely stopped, and so she was completely stopped in a Mercedes, one of the truck type vehicles, just didn't even brake and hit her at like 50 miles an hour. And so she sustained this whiplash injury. Now, she didn't actually hit anything. She just had a severe whiplash injury. Now, after that, she got very confused. Her cognitive function went way down. She was having a lot of difficulty making associations with things and even recognizing common, ordinary objects. Like, for example, when she was using, you know, she knew that the key was the key to the front door of her house, but she didn't know how to put it in the lock or unlock the lock or what to do with it. And so it was really kind of sad. And so we scanned her brain after the whiplash injury, and here's her brain after. So we see a marked decrease in the prefrontal area, which is again focus, concentration, impulse control, temporal lobe, which is memory, short-term memory, language processing, association, information. And one of the other really valuable things, I think, at least in looking at comparative studies of patients, is that with this particular program and what we can do with the information, we can actually compare the individual's brain with an age-matched control population who were scanned and were screened. And this was the work done by Dr. Mina at UCLA Harbor, where the individuals who were scanned in this normal, healthy population did not have a history of brain trauma or ADD or anxiety or depression or any of those sorts of things. And so now this is just a side-by-side comparison to her brain before the injury and after. And then now this one is the one that shows her brain compared with an age-matched control. So wherever you see this gray color, that matches up closely under the bell-shaped curve with this sort of normal population. Light blue is 2 standard deviations less blood flow. Darker blue is 3, and the darkest blue is 4 standard deviations. So we do see a lot of normal, comparatively, activity and blood flow in this undersurface of the brain. And this is before the accident. There are also areas of decrease, and then here's her after. So this just shows that this whiplash injury just took out essentially the prefrontal part of her brain and her temporal lobes. So now the thing that was the most helpful for her was, first of all, time, and second of all, hyperbaric oxygen therapy. That actually helped her regain a lot of function, and she had to, no longer could be training as a therapist, but she actually improved significantly. But it took I think she had maybe 60 or 80 hyperbaric oxygen therapy treatments and like a year, of recovery time. So this is actually where, these kinds of studies can be very helpful as well. And they're used, and I'm not really that involved with this, but in forensic evaluations and, in the court to determine, the effects of either trauma on the brain or these other things. Now this one, I want to just go through kind of the, this is more going to be focused on evaluating sort of psychiatric conditions along with the clinical history to show you what some of these things, depression and anxiety, look like. So there's that again. Now what we use BrainSpect for, in addition to the clinical history, which you have to always do in conjunction with the BrainSpect, because BrainSpect is just a tool that we have available. It's not perfect. It's continually evolving and getting better, and we're getting more information as we go along. But it's just an imaging tool that we can use in conjunction with the clinical history in particularly difficult cases, and I've found it to be extremely helpful in my clinical practice. But basically where it comes in handy is for these diagnostically challenging cases, non-responsive treatment cases, brain trauma, toxic exposure, substance abuse evaluation, those sorts of things. Again, there's the machine. I wanted to kind of go over these normal views. Okay, now here's a person with an attention deficit disorder, the hyperactive impulsive type, and you see the decrease in the prefrontal area, which we're finding is what causes, the attention deficit disorder. And these are genetic conditions. And this is him, off medication, and then here he is treated with Adderall. He had a good response to Adderall. Now, it's not perfect, but there's an improvement. So some were asking, what are the effects of drugs, prescription drugs on the brain? Do they make things worse or better? Or, if we could do some of these studies Wouldn't that be helpful in determining if this is, helpful or not as a, imaging modality? And in this case, yeah. So you see the difference. Here's before and after Adderall. Now, the place where I find this quite valuable and helpful too is like when you're going over the SPECT scan results with parents of a kid or even a kid, and you can show them, the reason that little Johnny is having trouble in class and he can't focus and sit still, and you're just really struggling with him with homework and that sort of thing is because of this. It's a real physiological medical problem that it doesn't have really much to do with parenting, although there are parenting techniques that can be done that help kids with ADD, but this is pretty much, a physiological medical kind of problem that he was born with. So that's how we're going to try to treat it and deal with it, from that perspective. Yeah.
Have you done any brain scans on any of the work that Posit Science has been working on to remap the brain that's been very effective with the ADD people and all kinds of the learning disabilities and autism and that? Have you done any brain scans on that? No, but I would like to. Dramatic changes that happen just because, somebody forces the brain to work different for a while.
Yes, that's a very good point. And maybe over the last 3 or 4 years, I've been referring quite a bit to practitioners who do the interactive metronome technique, which is very interesting, and there's a good, scientific literature sort of underlying it. But for attention, focus, concentration, auditory processing issues, a lot of kids with Asperger's who have social skills problems and auditory processing problems, and then just with kids with attention, focus, concentration problems, I've referred them to this interactive metronome technique, which is basically you put on some headphones and listen to a sound that comes at a regular interval. That's the metronome part. And then when you hear the sound, you're supposed to either hit the space bar on the computer, and then they get more advanced where you're tapping one side of the body and the other, the legs, that sort of thing. And you get immediate feedback from that. And they've sort of narrowed it down to, seems like 18 treatments seems to bring about the changes that are helpful. And I've seen significant improvement. Now, I haven't scanned people or kids or patients who have undergone that treatment, but I'd love to, because I'm sure you could see the difference, in the temporal lobe region and the prefrontal area. The other really exciting thing I think about like interactive metronome technique is that the positive changes seem to be permanent. So with biofeedback, I've had some limited success with that. While people are doing biofeedback, it can be helpful, and I'm not a biofeedback expert, and this has just been what I've heard back from parents and families I've worked with. When they stopped doing the biofeedback, some of the positive results seem to dissipate. With the interactive metronome, it seems to last. And so it can last up to a year, and then they go in for a booster and just do a few more treatments, and then they get back. So it's that's a non-medication, non-invasive technique that I have found to be very helpful in treating like ADD and auditory processing issues.
So it's the Posit Science course. It's all earphones and computer, and it refocuses the use of the temporal lobes and then whole other sections of the brain to repath itself, and it speeds up, and just exactly the same kind of thing, except it's a different system, but the changes are also permanent.
Yeah, and it seems to help both sides of the brain communicate better. With
Is it healing or remapping?
Well, I don't know. That might be just semantics.
It remaps
Yeah.
it, doesn't it?
It remaps it, and
Right.
so people that have strokes actually can regain full.
Right. That's
Very
remapping.
okay. Yeah. So it seemed, well, that's you know, all I know is the results are real positive.
The diet, do you find diet helpful at all?
Yes, definitely. Yeah, so higher protein diet, protein, staying away from simple carbohydrates, sugars, and regular aerobic exercise seems to be extremely helpful. Good hydration, you know, drinking plenty of water. And then there are some amino acid supplements that, now I know a lot of you are much more knowledgeable and sophisticated in that field, but
There is a
yeah.
story that a cup of red wine a day, like the French do, improves the situation. Do you have any evidence about that?
Yeah, the question was, does a cup or glass of red wine per day help with brain function? And actually they've done studies which have shown that like a half a glass of red wine, you know, maybe 2 or 3 times a week actually does, first of all, preserve brain function, and it can actually help with Alzheimer's not, you know, developing as quickly. So it doesn't cure it, but it sort of stays it off for longer. And it has to do with the antioxidant effect. So actually red grape juice would do kind of the same thing. But, you know, wine's probably more enjoyable. But white wine, no. Beer, no. Other alcoholic beverages, no. But red wine seems to actually help. Yeah.
Could you show a slide of somebody with post-traumatic stress disorder?
Yeah. Yeah. And do I need to finish? Or?
Yeah, I think that was probably our last question for the night.
Okay.
And we'll hit the lights so we can see that picture.
Yeah, let me just... Okay. Yeah, sorry about going on for... Yeah, let me get to that, because it's a fascinating study, actually.
Could you just put through?
Yeah. So, okay, well, this is a case I did, a girl with ADD, decrease in the top area. She does her concentration study. You can see the significant decrease in the whole cognitive functioning part, and then here she was treated with Adderall. Now, she had a good response to Adderall. Not everybody does, but you can see the difference. It's just amazing. This is what Asperger disorder looks like, anxiety conditions with overactivity in the basal ganglia region, depression, limbic area is significantly overly active. That's what depression looks like in the active view. Here's a bipolar disorder, and then this is what bipolar looks like. So remember, this back of the brain is supposed to be all calm and quiet. So basically the bipolar person, their brain is inflamed, way overly active. This is a fascinating case of a kid with some bipolar issues, but he also had a subarachnoid cyst, huge, in the right temporal lobe region. And once we discovered that, he was sent for neurosurgery. It was treated, and he got significantly better. We were, the parents were ready to send him to residential treatment, but we decided, well, let's do a scan. Now, here's the post-traumatic stress case. So this is the last thing of the night that I wanted to show you. This was a gal who had pretty significant trauma, this is her brain scan. And typically with post-traumatic stress disorder, you get this sort of triad, overactivity in the cingulate. This is the front of the brain, here's the back. The cingulate, which is what gets you stuck on the recurrent thoughts of the trauma and obsessing about it, and you just can't get it out of your head. The basal ganglia is the high anxiety. Fight or flight, can just be triggered by scent or any reminder of the trauma. And then the limbic area, which is the mood component, this is the cerebellum, which is typically very active. Now, this gal had several treatments, therapeutic treatments of cognitive behavioral therapy, and they rescanned her brain, and there wasn't really any significant improvement. Then she had 4 treatments of EMDR, and she was also taking some St. John's wort, but the EMDR, look at the difference. So this case was presented by Karen Lansing, who was actually the therapist at down in Aptos, who set up the field trip. And she's an outstanding therapist, but she was the one who did the work with this gal. And the brain scan was significantly better, but also the patient was reporting a marked decrease in the PTSD symptoms, the anxiety, her mood had stabilized. And this was only after 4 treatments of EMDR, which seemed to really work.
What is EMDR?
It's a yeah. So go ahead. Eye movement desensitization reprocessing. So it's a specific technique that's been developed by Dr. Shapiro, I think, who sort of Francine Shapiro, and it has to do with rapid eye movement, and the therapist kind of moves, and you follow, the hand movement as your eyes are moving. And then you're kind of going through the less significant traumas in the safety of the therapist's office, and then you work up to the more, traumatic experiences. It seems to help free up the strong emotional charge that gets trapped, basically, and walled off in the brain as a protective mechanism. That happens with post-traumatic stress disorder. So somehow this technique sort of frees up that energy, and it works. So anyway, that's what I wanted to tell you tonight, and maybe one more question.
This should be shown into every class in the United States, every high school class in the United States. Is anyone doing anything to do nothing?
Yeah, I would love to. Because, they had that really good, I thought, ad campaign on, this is your brain on drugs with the fried egg and everything.
Some of those
and that was,
you distribute to high schools?
Yeah. Mm-hmm.
Are they available? Can we order them from you people? And
oh, sure. Yeah. Yeah. Mm-hmm. And I actually, put it on YouTube or something. Or do, I've often thought what an effective anti-drug campaign that would be to just show some people some images, or kids images, and get it out there. But that takes a lot of coordination and money and involvement, and it hasn't happened yet.
Well, Dr. Clint, I'd like to say thank you very much for coming.
You're welcome. Yeah. Thank you.
So this concludes our meeting tonight, and I'm
in the near future, and the first one today is on hydration and rehydration. Jake, his background is he's a certified fitness instructor with the National Academy of Sports Medicine and has been a fitness instructor since 1988. He is the owner of InFit, a fitness studio in Los Altos where he assists clients with individualized health and fitness instruction. He has personally experimented with many nutritional and fitness modalities in order to restore his own health. He draws on these experiences to share his many wellness discoveries and his understanding of the body's immense ability to restore itself to good health. Well, please welcome our first speaker for the evening, Jake Brzakovich.
Past year or two about the need for vitamin D. Cognition is the last part, and maybe one that some people would say, well, how is that a vital function that you can live without? Basically, as we've gotten intellectually sophisticated, we've become more vulnerable to our minds. And therefore, the impact of things like depression, anger, frustration, criticism, and all these things can profoundly affect our health in adverse ways. And therefore, I consider, people can lead themselves to suicide just from depression. So cognitive states are very important, and therefore I consider them a vital function and one that we must keep in mind when we're looking at the big picture of health. Nothing new. People would say, well, that's just mental health. Correct. That's what I mean by that term, cognition. Another idea here that comes through healthology, which is a kind of fundamental idea related to diet and its profound impact on health. Some ideas to help us think about healthology, thinking about our health, to form a paradigm so we can keep certain things in mind so we can be more effective in cultivating good health. The first and foremost, that our bodies naturally strive to be healthy. I think it's really evident to me. When a person is well, you're bubbly, you have energy, you can do things. When you're ill, you're tired. It seems that when you are well, energetically it's less demanding. And when you are ill, it seems to be energetically more demanding. And the body wants to be energetically efficient. It wants to get away from expending too much energy and moving into a state of less energy demand. That's wellness, that's health, and that's why I believe that the body does strive to be healthy. The second point is an important one to remind ourselves of, which is that we either promote or oppose this intrinsic wellness tendency of the body. So we cannot not participate. We are actively involved in either promoting our health or opposing our health. And it's very important to know that. It could help us motivate ourselves in ways to act in our favor versus against ourselves relative to our health. Number three, these vital functions, again, I call them vital because they are so important. When they are normalized, because of the first rule, it's, in a sense, health naturally and spontaneously arises. If we can focus on these vital functions and focus on naturalizing them, making them healthy, in fact, what we naturally get is good health. It's just that simple. Number three talks about what happens when you have vital function deficiency. If you have impaired vital function, I believe that that leads to either primary or secondary precursors to all diseases. I'm of the opinion, from my years of experience dealing with my own challenges, health challenges that I've been able to address, that it's amazing how these vital principles or vital functions, when deficient, can manifest symptoms of disease in so many different ways. It's quite astonishing. So if we have impaired vital functions, we are going to have some type of a disease state, either to occur, it's in process, or it has manifested. And I think that's important to know because, again, where do we focus? If we look at these vital functions, we can get a sense of our state of health. Again, just a couple more points. The normalization of vital functions is essential to any restoration effort. So if a person has deficiency in health, to address those, in my opinion, the normalization of vital functions is essential to any protocol. I don't care what else you're doing for yourself. Looking at these vital functions and helping them normalize will, in effect, help anything else you're doing to promote your health. And the second point is basically saying that investment, in terms of your effort, in terms of putting in time to make yourself well, the return on investment is by far greatest when you're focusing on these vital functions. There's nothing else that will produce as much good health for you for the same amount of effort as the effort you direct towards normalizing these vital functions. And the last part basically tells us how we go about doing that. In a sense, vital practices are the means to restoring and sustaining these vital functions. So we have these vital functions, and then we have vital practices to address them, to help them become normalized, healthy, and therefore, as a consequence, to have spontaneous good health. A couple more thoughts based on the fundamentals of health. Depending on exercise, depending on sleep for our well-being. Of course, notice that those factors are part of those fundamentals. Here are the vital practices. Very simple, to be expected, pretty much corresponding to what we have originally stated as the vital functions. Hydration, nutrition, exercise, detoxification. These are the practices. These are the things we focus on. In hydration, we want to look at a few things. What do we want to drink? Lady asked this eating about alkalinized water. Is that a good idea? If it is a good idea, let's put that in. So we want to be clear about what we drink, when we drink. How about caffeinated drinks? Is that okay? If you're juicing, is that a good substitute, etc.? With nutrition, similar questions can be asked. to refine our approach to this practice. Exercise, same thing. What to do, when to exercise, how much to exercise, frequency of exercise, etc. Detoxification, looking at things like fasting, exercise, saunas. These are the types of things that I hope to revisit with you. If I have the opportunity to come back, we'll take one or two of these and just talk about some fundamental principles to integrate into our daily practices. Rest and recovery is, of course, going to answer our need for restoration. Quality of sleep, when to get to bed, how much to sleep, is meditation useful, stress reduction, etc. Illumination, just a few things about there, making sure that we're getting that light exposure. I know some people will say maybe that will not be enough, but that's fine. I would like to begin with that, to incorporate things like possibly indoor lighting, full spectrum indoor lighting, which is what I like to use in my home. And little things like that to support this need for the fact that we are light beings in need of light. The last part is positive psychology, addressing our cognitive vital function. Things like optimism, as many of you probably as well. Humor being a very important component to healthy psychology. Good relations, creativity, and many other things. And we can talk about those details, which is outside the scope of the presentation this evening. But at least you can see the 7 points, the 7 practices that correspond to the 7 vital functions. Let me take just a little bit of time and talk about a few things about these practices that I think are really good to know. So you have the vital practices. They're the principal focus and responsible promotion of health. All I'm saying is here, if we can all agree that personal responsibility is an important ingredient to promoting and preserving our health, the first place we should begin is addressing these vital practices, which are addressing the vital functions. The very first place. That's really where, in my opinion, our responsibility is defined. Our work is cut out for us, in effect. Second point, the holistic aspect of vital functions. All I'm basically saying here is, even though we're doing 7 things in terms of categories of things to do, I don't want us to underestimate the impact. That doing 7 things may impact 7 million things in the body. And that even though you're only doing a few disciplines, these disciplines are very powerful, very potent, very capable of producing the health that we all seek to have. With the following point, interrelated and synergistic, I think this is a really interesting property here. It talks about kind of the holism of the body relative to these functions. If you look at hydration, nutrition, exercise, and detoxification, if you take just hydration and adequately hydrate your body, if you move over one category, to nutrition, you'll notice that it automatically enhances your nutrition. For example, it may reduce false appetite, which is caused by dehydration. When you have false appetite, you have a tendency to overeat, gain weight, and all the other consequences arise from that. If you move over one more category, exercise, what does proper hydration do for you there? It gives you a much better ability to produce energy. So when you're well hydrated, you can exercise more effectively. You have more energy to exercise. What does that mean for the category over, detoxification? I can sweat more. If I can sweat more, I'm helping my body detoxify itself. So that simple introduction of water into one of the 7 categories permeates through all of these. And I think that's really a powerful thing to notice, and therefore an important thing to recognize. The synergism is just basically saying that basically the whole is greater than the sum of the parts. If you do these practices, what you'll notice is the effect somehow seems to be greater than what you would expect just by adding those 7 parts together. As I said, the whole is greater. What I also think is interesting is the vital practices suggest supplemental needs. If you focus on the vital practices and you're cultivating good health, and then upon doing all that, you notice that the deficiencies exist, there you are now being helped in identifying what supplements to introduce. Because by addressing the fundamentals, you now can tell, here's an area that's not being completely resolved. What can I do for that? Let me introduce some supplementary or supplemental help. So that's a nice thing that focusing on vital practices helps. And the final thing is that the vital practices are primary preventive. In my opinion, nothing else will act as a greater preventive to disease. And I've just been talking about promotion and preservation of health. That I believe wholeheartedly, but also nothing will act as a greater preventive against disease and deficiency of health than focusing on these vital practices. In conclusion, good health is intimately related to vital functions, and in my opinion, healthy vital functions lead to good health. The other thing to keep in mind, a good reminder for us all, is good health is a choice one day at a time. Every day, we are choosing to either support or oppose our intrinsic tendency to be well. And I think it's very important to recognize that fact. And to be mindful of things that we do that we know, well, you know, maybe I shouldn't be doing this. To realize, you know what, I did something like that yesterday, and I did something like that the day before. And collectively, I'm really working in opposition to my body's tendency to make me well. And it's good to be that aware about the process. The last part, the vital practices, committing to them, in my opinion, is truly a means to a definitely healthy, happy, and long life. No doubt about that in my experience. I don't want you necessarily to take my word for all this stuff. I can tell you that these ideas have been ideas that I've abstracted from my own experience. And I challenge you to do the same, to really see the power of being mindful of these vital functions and the vital practices that really need to be addressed. Another thought, just to cap things off. Health and happiness, intimately related. This is my contact information. I don't know how much time we have for questions, if any time. But if you guys have any questions, you'll feel free to come up to me at the end, in between speakers or at the end of the evening. I'd be glad to talk with you. You can also reach me at jake.infit@gmail.com and also at my business phone as well. Again, a thought for the day, one that I keep on the back of my business card as a daily affirmation to remind myself, really, the paramount importance of good health, and that nothing should precede it in importance in our lives. Thank you very much for your time.